And we should be going live now. Beautiful, and we're live. Sweet, all right, so I think we're all good to go. We did have a large amount of RSVP, so thank you everyone for registering for this event. We're really excited to host it. We were trying to think of a creative name, and the best we can come up with is Native Community Immunity Virtual Event. So hopefully that sounds a little engaging. Should be a fun session. And yeah, thanks for joining us during this time as well. I think we usually host our events like late afternoon / evening. So we want to try something a little bit earlier. And I'm glad that the registration rate was so high. So that was really great to see. So welcome again. My name is Jesse. I'm with the California Native Vote Project, Tonaotam Chicano. And yeah, just a quick overview of the event for today. The main idea is to help share information regarding the COVID-19 pandemic, the vaccinations, and also share facts, stories. So hearing directly from our some of our Native medical professionals here in the state of California. So if there's any sort of hesitation that you as an individual or folks in the community that you may have seen, hopefully some of the information, some of these stories that are shared today can help influence folks in a positive way. At the end of the day, the title says it all, right? We want to make sure our communities are safe. We want to make sure our communities are vaccinated. And that's what's most important. So we do have 4 speakers for today. For the first part of our agenda, we're going to have Pat Lopez, who's an RN, who's been an RN and a nurse practitioner with United American Indian Involvement. So our LA folks definitely know her. And our second speaker too, Dr. Blackwater, who's also at UAII. So we want to thank them for being present today. And Virginia, so Virginia is representing our Northern California region. And then she's the executive director for the California Consortium for Urban Indian Health. So she does do work statewide. So we're really happy to have Virginia. Welcome, Virginia. Calvin is also, he's also joining the session. I saw him on here. So hey, Calvin, both representing today. And yeah, we wanted to get started in a good way by having Robin Thundershield start us off with a prayer. But before I forget, we also have a second part. So it might have been a little bit ambitious to try to squeeze everything within a 1 hour time limit, but we do have a really great presentation by Cameron. So he's going to be going during the second half of the meeting today. He's going to be talking about how to identify and report COVID-19 mis and disinformation. So yeah, we're going to hear directly from our medical professionals and directly from Cameron, who's doing this amazing work, amazing project. So yeah, Robin, I'll pass it along to you. If you want to start us off with the prayer, please.
All righty. Good afternoon, everybody. Thank you guys so much for joining us today. My name is Robin Thundershield, and I'm a member of the Standing Rock Sioux Tribe. And if you all can join me in saying a little prayer before we get started. Thank you so much, Jesse, for giving me this honor and allowing us to do this prayer before we start this wonderful event. So here we go. Creator, thank you so much for another day of life. Thank you for all our blessings, and thank you for bringing us all here today to meet. Thank you so much for allowing all our speakers to be present. And Creator, I ask of you today to please fill our hearts with your spirit and help us to have open hearts and open ears as we educate ourselves and our community members about this virus and about the vaccine that protects us in contracting it. And I also pray, Creator, that you watch over all of our elders, all of our children, all of our babies, our future generations. Please help us to bridge our divisions and come together and find a good way to move forward and combat this virus. So that way our babies don't have to go through this, especially our children with this upcoming school year, all the jobs. Please help us to return to a good way, to our community events, to our cultural ways. And again, Creator, I ask that you watch over those that are still traveling, that are going to be joining us a little bit later, to watch over them, keep them safe, and just please fill our hearts again with your spirit. I ask this in your name, Creator. Balamia. Thank you again, Jesse.
Awesome. Thank you so much, Robin. Thank you for sharing that. And yeah, I mean, we definitely want to host this event in a good way. We know that the past over a year now easily has been really rough on our communities. And we wanted to do it in a way where we're not just basically giving you direct information, reading what from the CDC directly or some of the trusted sources, which is always good, but we wanted to make it a little bit different by hearing stories, real testimony from members of the community and from some of our leaders. So we thought this would be a little bit more powerful. And so we do have time for some questions that we developed beforehand for our panelists. For folks who are interested in asking more questions, we welcome you to do so. We probably won't have time realistically to address any questions, but we will be following up via email. So for all of our folks who registered, we'll follow up with responses to any questions you may have. So that would definitely happen. So both on Facebook, if you're joining us on Facebook, welcome. Feel free to drop your comments in the chat box and or in the comment section, and then we'll be responding after the event. So we do have a few of our staff members monitoring both Zoom and Facebook. So we'll make sure to collect all the questions. So yeah, rest assured, we'll be keeping track of them. But without further ado, let's go ahead and jump into our first agenda item. So this is going to be our native medical professional panel. As opposed to reading bios, I'm going to let our amazing panelists do self-introductions, starting off with Pat. Oh, I think you're on mute, Pat.
Okay. Cuatiopa, Amedoa, Patricia Lopez, Taos Pueblo, New Mexico. I'm a nurse practitioner, OBGYN and family at United American Indian Involvement, and I've worked as a nurse practitioner since 1979. A lot of experience with the AIDS virus, etc. And my topic is side effects and what is the difference between the emergency use of the vaccine versus the traditional. So for the side effects, we have vaccinated nearly 1,400 of our community members here at UAII, and 1,000 plus have been Native American or Alaska Native. The side effects, I would say that in the very beginning, there was a lot of hesitancy and fear, and I think it was justified. But because we've been talking to our community, we in the clinic and our case managers and really all of our employees here at UAII, clarifying issues that they might have, I think that's why we've had such a good turnout. And in LA County, Native Americans, Alaska Natives have reached at least 56% vaccination rate, second only to whites in LA County. And I think, and that's due to all of our efforts. So some of the side effects that we've been seeing are there's three categories really. General is pain and the, the vaccination site, and maybe some swelling and redness. There's headache, fatigue, muscle ache, some nausea, and maybe even some vomiting. But the I would say in our population that we have vaccinated, that I have vaccinated personally, the two things that people say after the first one, oh yeah, my arm hurt a little and I was really fatigued. Those were the major things that they complained about. And they weren't long lasting, usually a few hours or at the most 2 days. So that's good news. Even though you may get these symptoms, they are not long lasting. And that's a good thing. And then the second category would be the severe allergic reactions, difficulty breathing, swelling of the face and throat, a fast heartbeat, bad rash all over your body, dizziness and weakness. But there are treatments, and we urge people to go to the ER if they should experience these, but we haven't had any of these really in our population. Oh, we've had one, Dr. Blackwater said, one. So, and I think, we have done, or we tried to do a really good job of making sure that the clients read the fact sheet and ask us if they have any questions, and we can discuss it with them, before. And also, when they fill out the checklist, it allows us to know if they are eligible for the vaccine or not. So even those who have tested positive for COVID, whether they were symptomatic or not, it doesn't matter. We will vaccinate them, and they need the vaccine in order to prevent long COVID. And I'll talk about that in a minute. So, but they need to wait at least 3 weeks after their first test came back positive. And then, so the severe, well, I already told you the severe category. So the third category are the unvaccinated. Now, the unvaccinated could be positive for COVID on a test and be completely asymptomatic. But through their aerosol, through their droplets, they can infect others. So we really urge them, even though they say, oh, you know what, I was positive, I'm fine now, I don't have any symptoms, but you can pass it on to your loved ones and your community. So you need to get vaccinated. And this is what we tell them. So long COVID is bad. Long COVID, in addition to all the horrible symptoms that you get with COVID, if you're really sick or hospitalized, also has a cognitive equation with it, where sometimes you won't be able to do numerical numbers, you won't know your address, you don't know where you're going when you're driving in the car, all these horrible things, and they can start up like within 2 weeks of you being positive, and they can show up months and months later. 4 months is what we're talking about now. So 4 months from now, if you tested positive and you were asymptomatic, you will lose some of your memory and your cognitive abilities. That's very serious to live with. So we urge those people to get vaccinated. So enough of that. So what is the difference between a traditional okay by the FDA and the emergency authorization use? Very little, because the FDA is the one who allows the emergency usage. So the emergency, I'll call it EUA, is not new. It's been done for a very long time. And I remember it being done with the HIV outbreak, and we had those new drugs on board. So it's nothing new, and it's still authorized by the Federal Drug Administration. They have the full authority for approval of all medications, vaccines, and appliances. Traditional approval requires years sometimes. So, in this particular pandemic, it was urgent to get vaccine to the community. So the FDA can approve emergency use if the vaccine meets certain criteria, and if there's no adequate, approved, or available alternatives, the FDA can declare it an emergency use. Being in a pandemic that is severely sickening and killing us, and a long wait for traditional FDA authorization is not acceptable. So we should not fear this, because it's not something new. This is not an untested vaccines that we have. the three of them. They have been tested thoroughly. The FDA's decision for EU is based on the totality of scientific evidence available showing the effectiveness of the vaccine, Moderna, Pfizer, and J&J. The known potential benefits of the vaccine definitely outweigh the risks of acquiring COVID, which could lead to serious illness or death. UAII thankfully has not had an occurrence, well, one of a serious reaction. So there is treatment for it. If one experiences these reactions, they go immediately. We send them immediately. We should send them. As I said, we only have one to the ER for treatment. So I think the record is pretty good. Out of about 1,400 people who've gotten vaccinated by us, you know, only one person has shown, you know, a serious side effect. So the vaccines, all three of them meet the FDA's criteria for use in COVID-19 pandemic. And really, at this point in the pandemic is about those who are unvaccinated. Both Moderna and Pfizer will soon receive full FDA approval, we have been told. So we're waiting that. And so, but there's no reason for you to wait to get vaccinated. It's perfectly safe. It'll help prevent a myriad of things that you do not want to have. Thank you.
Awesome. Thank you so much, Pat, for all of that great insight. And
Oh,
yeah,
one thing I wanted to say
go ahead.
is at each vaccination session, there were people who were so frightened that they came to us and sat in the chair for their vaccine, shaking, literally shaking. But I would put a basket of sage out in the middle of the room where we were vaccinating. And I think that had a very positive effect on our community because they went for that basket, took their sage and sat down and were calm.
Oh, thank you, Pat. Yeah, I think this is the first time I hear of something like that. So I know when we talk about like culturally inclusive healthcare, like this is exactly what we're talking about. So that's really nice to see. Thank you. And I know in LA we had a chance to host a few vaccination pop-up events too, and I'm sure they've been happening throughout Northern California too. So for our folks listening, for our folks tuning in, also please feel free to drop in. Like how do you feel about going to traditional healthcare centers to get vaccinated? Do you like that idea? Do you also like going to pop-ups? Like what are your preferences? Just out of curiosity. So thank you so much, Pat. That was really great information. Next, we'll transition over to Dr. Blackwater, also at United American Indian Involvement, and they're actually in the same room, right? So you may hear a little bit of an echo there, but Dr. Blackwater, if you want to go ahead and introduce yourself, please, and feel free to jump right into the questions, just like that.
Okay. Yeah, Dr. Blackwater, Wizaklana, I'm born for the Twittigenes, Navajo, full-blood, urban Indian. Grew up here in Los Angeles. I had to say that, but Pat needed to include that too. She's also grew up here in Los Angeles area too. And I've been working here for a good long time. Actually started the clinic here with the help of some nurse practitioners that really helped us out here and public health nurses. So anyway, you gave me some really interesting questions and I'm thinking some of these questions, I don't know what to say about them, but he was asking me about this business about spacing people and wearing the mask and all that stuff. Hey, that's a no-brainer. How do you know that next person to you was vaccinated? How do you know if somebody else starts coughing without their mask, did they get vaccinated? Especially with this new variant happening. Maybe you were vaccinated, but I'm just thinking, wear your mask because it makes everybody else wear your mask. You show by example. I bet that's just a no-brainer for us. We want everybody who comes into the clinic and to UAI here physically at 6th Street to wear a mask, because we don't know about those things. And those who are vaccinated, who also have other pre-existing conditions, if they have asthma, if they have immunosuppression of some sort, they need to wear their mask anyway. And I've just noticed some of my patients that come in and said, hey, Dr. Blackwater, I haven't had an asthma attack since way back when. And I said, hey, the mask is working. So it's like, it does help with some things that you don't think about.
And the flu.
Oh, and the flu hasn't really made a big showing. Right now we're having RSV though, some viruses that usually happen in the winter. So there's some things starting to resurge because some people took off their mask. But right now, please wear your mask. And how do we determine the transmission rate or risk? Okay, that has a lot to do with when I do a report just about every week to Indian Health Service for the state of California, telling them how many people we actually tested for the virus and how many positives we had. And thankfully, we haven't had that many positives here, but in the community, yes. And thankfully now I slowed down and coding people who have died in our database. Hate to say this, in December and beginning of the pandemic, it was like one a week. And December and January was just terrible. We finally got our vaccine and that kind of slowed it down. So that's kind of what we've been seeing here. And the other thing I noticed about some of the post-COVID people, I mean, she told you a little bit, but we've had people like burn down their places because they couldn't smell. The kids are telling us she's over seasoning or she doesn't put anything in there, the person that cooks, and then losing their cell phones and all kinds of weird things. I had one person had asthma and she had for 4 months could not work because she would cough almost continuously. And that's post-COVID problems. And she couldn't think and she couldn't sleep. So those are a couple of things. I don't know if you ever want to go through that. You're so tired, you want to sleep, but you can't sleep. That's another problem with the post-COVID people. And I don't know what to tell about somebody who's hesitant about getting vaccinated. It's kind of a weird question. I just think even if you had the virus, please get it. I mean, for some reason seems to blunt some of those post-COVID problems. We noticed some people that had it, and once they got it, like some of those things start lifting off of them too. So it seems to help protective quality with it. I don't know. Any other kind of things you want to know about this? I mean, we've kind of slowed down on testing people too, but I have a feeling if this Delta variant gets around more, we're going to have some more positives again. Any other questions?
Thank you so much, Dr. Blackwater. I think we may have seen a couple quick questions come in. Let me just double check. Maybe we can just take it directly to the chat here. But maybe just real quickly, Dr. Blackwater. So we know that, yeah, our Sequoia clinics, our crib clinics, places like CVS offer vaccinations. So just like in general, where can folks get vaccinated?
Oh, those same places. I think Friday we're having a special clinic for the kids. So the nurse here said we're going to go ahead and whoever wants to get a COVID vaccine can come in. You don't have to be registered. You can just come in and say, I want to get it. The only thing is once you get the permission and all that, you need to stay for 15 minutes afterwards, at least, just to make sure that you're not going to have any problems with it. And somebody put down, do we have the vaccination for adolescents 12 and above? We don't have the Pfizer vaccine. To take care of that vaccine, it's really hard to, it comes a big big lots, and we just think we're going to waste a bunch of it. We try to do that. We do have the Moderna. Hopefully, every day I've been checking Academy of Pediatrics at CDC when they're going to say, okay, we can give the Moderna to the 12-year-olds and up. We do have Moderna here. And we also have the J&J, the Janssen vaccine, for those who just want to have the one vaccine and be done with it. But right now we don't, as far as what the CDC and the FDA said, we don't have one for the 12 and up above. But as soon as they say, okay, for the Moderna, we're going to start giving it.
Got it. Thank you, Dr. Blackwater. Really great information. And for our folks listening in, yeah, I know we've been touching on the idea of like potential hesitation amongst community members too. So feel free to drop it in the chat here on Zoom or in the comment section on Facebook, just what you've been hearing around in the community. Lots of the organizations on the line here, or lots of representatives from the organizations on the line, are currently developing messaging, or it's ongoing messaging development. And we want to make sure that we're able to address some of those potential, fears and reasons for hesitation of getting vaccinated. So please let us know. Yeah, we'll just compile a general list of like common themes, common questions, common ideas, and then we can take it from there and basically develop messaging off of that to help alleviate some of those concerns. That's our goal. But thank you so much, Dr. Blackwater. This is really great. And man, we have Virginia next. I wish, yeah, maybe next time I'll give at least an hour and a half. This is really quick. We can talk all day, and I'm sure folks have a lot of questions as well. So please remember to drop those in the chat or in the comments section. Next up, we have Virginia Hedrick. Virginia, please feel free to introduce yourself and feel free to jump right into the questions.
Sure. Aikui Naknau Virginia Hedrick, Shregon Mewamechuk Nakpulakla. Good afternoon. My name is Virginia Hedrick. I'm a member of the Yurok tribe and the executive director for the California Consortium for Urban Indian Health. Thank you, Jesse, for inviting me to join. And I'm so honored to join these such talented and beautiful and far more seasoned professionals than I, and appreciate your responses to the questions and really your on the ground frontline work during this pandemic. So I really want to acknowledge that the two of you, among many others working in our urban Indian organizations, have really been on the front line of the pandemic. New recent data coming out has really shown the deep impact of COVID-19 to our urban settings, and which really situates programs like UIAI as being on the front line. And so I want to appreciate you and thank you for your work. I have some really interesting questions here too. Thank you, Jesse. So the first question for me is, how does herd immunity work, and are we almost there? So there's been a lot of buzzwords in this pandemic, and herd immunity is one of them. Herd immunity is something that we started talking a lot about when we first got introduced to the vaccines in December, when we got that emergency use authorization for Pfizer, and then a week later, Moderna. I want to just back up what these two women have already shared is when you look at sort of the data trends for COVID-19, in December, our healthcare professionals have access to December 2020, healthcare professionals begin to have access to the vaccine. And in January, it becomes more widely available to the public. And in January, we also see a case rate of 60,000 cases per day in the early days of January. The single most effective thing that has made an impact in the case rate is vaccines. No other behaviors changed. It's really, we can say nothing else has been as effective as the vaccine. Are there effective measures in reducing the spread? Yes. And should we all continue to do them? Yes.
Back here at home, the mother accused of murdering her 3 young children set to face a judge first time today.
I don't know where that's coming from.
After her kids were found dead in their East LA home.
Do you hear that?
Eyewitnesses reported.
Hang on, I don't know if that's coming from me.
That's eyewitness news sneaking in somehow.
Okay, there we go.
I don't know how they got in, but anyway, that was straight out of eyewitness news at 3.
Was that me?
There we go. I think you were the only one with the mic open.
Okay.
Okay, there we go.
Okay. That was really weird. Thank you. Okay, so herd immunity is scientifically, and we can look at other infectious diseases such as measles, herd immunity means when a certain percent of the population have reached immunity. They have either natural immunity, that means they've gotten the disease and they have some level of protection from being reinfected, or they have been vaccinated. And there's really not a magic number. It's not we reach 80% and that's it, we've achieved it. It's sort of flexible. So many epidemiologists would say that herd immunity for COVID-19 is somewhere in the range of 70 to 90% of the population would have to have immunity. We know that with our vaccines, we're seeing greater than 90% protection from getting COVID-19 if you've had the vaccine, and 100% protection from hospitalization and death if you've had the vaccine. There has been new studies coming out of, I found a study out of Denmark that really showed protection from reinfection if you've had COVID-19 is about 80%. If you've had COVID-19, that you're about 80% protected from getting it again. Once you reach the age of 65, your natural immunity, if you've had COVID-19, drops to only 47% on being reinfected. So there are a lot of factors here. Age is not also a magic number, right? And I know that our healthcare professionals know this. It has a lot to do with your body and what your body's been through. If you have, any kind of chronic illness, if you have asthma, if you have diabetes, if you are overweight, those are all going to play factors into your ability to be reinfected or not. So that's a little bit about about herd immunity. My personal opinion is if we're going to reach it, I think it's really doubtful, to be honest. And that's sort of like the bad news that we don't want to say, right? We all want to say we're going to reach it, but we're seeing mutations in this variant in ways that we did predict. I did a live session about 4 months ago, speaking specifically about variants and what we could expect to happen. The virus is a living thing. It is going to modify itself to stay alive. It has its own survival mechanisms. So in viruses that are incredibly deadly and they kill their host, they are often don't spread as fast because the host dies. So a virus will mutate to keep itself alive in ways that will mean that it will make itself more contagious, potentially less deadly, in some cases, increase complications. The Delta variant is one variant that we're looking at. There are multiple variants, and there are variants in California that have higher case numbers than the Delta variant. We're talking about the Delta variant because the Delta variant is showing very high levels of contagion. So it's spreading faster. It's more easily to transmit. And we know this because the Delta variant is spreading among children. Children are super healthy. They have these just really incredible immune systems. I mean, you see when you send your kids to daycare or school, they get sick for a couple of days and they get right back to it. The same kind of sickness might require hospitalization for somebody that's older. And so we haven't seen COVID-19 in our young people in the way that we have seen as the ages increase. So the fact that the Delta variant is spreading among children tells us that this virus has mutated in a way to keep itself moving and alive. And it's pretty scary thinking about our children being more susceptible to getting the Delta variant than the dominant strain of COVID-19. We do know that the vaccines protect against the Delta variant. Our earliest studies are showing really high levels of protection of greater than 80% with Pfizer. We're waiting on a study to come out with Moderna. My expectation is that Moderna will fare just as well as Pfizer in protecting against the Delta variant, as will the Johnson & Johnson vaccine. We have no reason to believe that they will not also provide that same level of protection. So that's a little bit about the Delta variant. That's about a herd immunity. Really getting the vaccine, where it comes to this community level is if I know I'm protected from getting COVID-19, I'm less likely to transmit COVID-19. I'm doing my part as a community member to protect the community members around me. There may be folks around me who are not eligible for a vaccine, such as my very own children. I have 4 children in my home under the age of 12, none of which are eligible for the vaccine. My concern around COVID-19 has increased as the Delta variant, more information has come out for them. So we in our household are still 100% mask wearing. We are social distancing in spaces where vaccination status is unknown, like public spaces, and hand washing. We're also testing. We can't lose sight of how important testing is. 3 of my children have a summer cold. I took them in to get a COVID test on Monday just to be sure. Those COVID tests came back negative. And that's another way that I can help protect my community, is to do routine testing for myself and my kids when we're not feeling well. The third question is, how can we help ensure that children are protected? And those are the pieces that I just shared, ensuring that I'm putting my children in safe spaces. We know that being outdoors, being physically distanced are ways that we can protect them. The pandemic has had deep impacts on everyone's mental health, children being one of them. Children are often very resilient and can move with change, but this has been significant change that we have asked them to do. We have asked a lot of them. All of my children have gained weight, so we're looking at moving our bodies more. We're looking at really paying attention to diet and exercise in ways that we haven't. And so there's more layers of how we protect our children than just protecting them against COVID-19, really making sure that we're nurturing their emotional health, their spiritual health, and their physical health as it relates to COVID-19 and as it relates to those other pieces. That's it, Jesse. I tried to keep my answers quick, but yeah, very, very great questions.
Thank you so much, Virginia. Great information. And yeah, I definitely learned some as well with what you shared. And I really hope, yeah, members of the community do, listen to these really important points. Exactly what Virginia was saying too. Like, our folks who are speaking are on the ground doing the work. Like, they've seen firsthand the impacts of COVID, have heard the stories directly from members of the community. And yeah, I mean, at the end of the day, we definitely do need your help. My assumption is that the folks who are attending this session are for the vaccine, right? So please help us. In trying to convince other members of the community to do the same. We want to make sure that everyone's protected, our little ones are protected. That's always our priority. And we're almost at time here for this agenda item, but real quickly, Pat, Dr. Blackwater, Virginia, what's usually needed for folks when they're interested in getting vaccinated? So as part of the California Native Vote Project, we're making calls to members of the community statewide from those on our list. There's confusion about whether you need social security number, like what if you don't have that, forms of ID. What's usually like the base set of requirements to get vaccinated? Is there a cost associated with it? Go ahead, Pat.
Yeah, we started vaccinating on December 22nd. At that time, Indian Health Service restricted us to only vaccinate our Native community. And so we did that, and we still have a number of vaccines left. And so we got a message from Indian Health Service saying, open up the vaccines to anyone and everyone. And that's what we are doing for the last, how long, Dr. B? Maybe 3 weeks now? We have opened it up to anybody who calls and says, I want a vaccine. We'll schedule a time for them, or they can walk in and we'll make it happen. And they don't have to be Native American. They just have to be 18 and over. And we only have the Moderna and the J&J. And our community does not like the J&J. We've only vaccinated 10 with J&J, and we have they sent us a total of 100 doses. So we need to give those out quickly because they expire August 8th. So anyone can come to UAII or call us and make a reservation and appointment. They don't need any kind of ID. They just need to fill out our information form about any serious illnesses they have at the moment, that kind of thing. So they don't need any kind of ID. We just did a vaccination at one of our Indian churches on Saturday. We were all geared up for it. We had 7 volunteers from our staff. Turned out only 1 person came for a vaccine, but we had a lot of others who came to ask questions and just to thank us for being there. And they were not Native. It was primarily a Latino community. It used to be mostly Navajo, but no longer. So we're wide open with a vaccine now.
thank you so much, Pat. Great information. And again, for our friends dropping in questions in the chat, just in case we don't get to them, we'll be transitioning here to a different presentation. So yeah, we are keeping track of them and we will be responding after the event. So rest assured, we're keeping track of them. So thank you so much to our great 3 Native professional panelists. Like I said, this went by really quickly. Maybe we want to give them a little applause here using the reactions on Zoom. I think that would be nice. Thank you so much for your time and for having this great information to share with members of the community. I wanted to transition over to a second really important piece. We actually had a chance to hear from this individual not too long ago. So we hear this great testimony, this great experience, these great facts from our medical professionals. And now there's also this other side of it, right? What about all the information that's floating around online that's not necessarily true? To some degree or another, we know that it's effective, right? There's conspiracy theories, there's ideas that are incorrect about the pandemic, about the vaccine. How do we identify that? I know most of our folks like going on Facebook. Like when we see messages like this on Facebook that we know aren't true, how can we be ready to report it? How can we make sure community members are getting accurate information? Or at the beginning of it, how do we identify it? What are some useful tactics to be able to identify mis and disinformation regarding COVID and the vaccine? So I wanted to pass it along to Cameron. Sorry, Cameron. I know this will have to be a super short presentation, but Cameron is currently the project director at the Algorithmic Transparency Institute. He recently did a presentation for some of our native orgs and backed by popular demand for sure. So Cameron, if you want to share a little bit more about yourself and then jump right into it if you'd like to.
Absolutely. First, let me just start off by thanking you all for the wonderful presentations that I heard before this. It's great to hear such well-researched and knowledgeable folks sharing good information. It's critically what we need more of. I also want to thank California Native Vote for inviting me today. I'm really happy to speak to this group and to share what we're working on and how we're trying to work with many different community groups like this to try and combat the challenges we face with mis and disinformation. I run a program called the Algorithmic Transparency Institute, where we monitor for mis and disinformation, and we work with lots of different organizations to support their work to do the same. Frequently, what that means is that we offer trainings, presentations like this one, to talk about what we mean when we say mis and disinformation, how we can identify it in the future, and how we can easily report it. And by reporting it, we mean sending it to us. By sending it to us, that means sharing it with a larger community of people who are working to combat the spread of mis and disinformation by understanding what different kinds of ideas are spreading in different communities, because what's spreading in your community in California, for example, may be very different from what's spreading in another community in another part of the country or the world. And so what we need to do is recognize that we all have a responsibility to be vigilant about the kinds of messages that are spreading within our communities so that we can respond to them effectively. I have a short presentation I will give. I'll probably skip through a few bits of it and then save some time for questions. There we go. So hopefully you're seeing my screen now. Here's the basic idea. We are in the midst of an infodemic. In addition to the pandemic that we're facing, the World Health Organization has said that the flood of information, some of it true, some of it not true, is something we're now labeling an infodemic. And it itself creates a problem. Viral misinformation is also contagious and it is also dangerous. In the early stages of the pandemic, we saw people sharing cures and home remedies that weren't legitimate, but were definitely put people at risk. Later in the pandemic, we saw even some elected officials sharing things that weren't true and could have been dangerous. Mis and disinformation puts us at risk. It puts us at risk generally and specifically when it comes to this vaccine and the hesitancy that we're hearing within our communities. This can come in many different forms. We hear lots of words batted around about what it means. It's misinformation, it's disinformation, it can be rumors, conspiracy theories. I like junk news. Even sometimes it can be hate speech. Whatever the form, it all misleads us. And so we have to be vigilant about all of it. And which label we use isn't necessarily so important. It can come in many different and unique forms, right? So content that is designed to make you fearful or feels like it's manipulating. Content that seems like it might be pseudoscience, information that seems sketchy but uses scientific terminology, may not be based on rigorous scientific research. Conspiracy theories. I think at this point, we're all pretty familiar with what a conspiracy theory is, and we've all seen and heard many of them, but they're frequently floating around in association with the pandemic and the vaccine. Missing context. Now, this is a huge universe of problematic content, and it can mean many different things. It's by far the thing that we see most often, and it's difficult to explain, but I'll show some examples in a minute. But anytime when you hear information that doesn't include all the details that you might need to actually evaluate it effectively, that's something that might be missing context and could be at risk. I mentioned hate and dog whistles. Broadly speaking, we see those things floating around on social media, and they're just as problematic as some of the more definitively mis and disinformation. We also see a lot of faulty logic, people making claims or arguments that are built on something that doesn't have a solid logical foundation. But when you make them and when you employ the rhetorical style that's convincing to people, they may miss the idea that there's some faulty logic that underlies it. Content that is old, things that were true even as recently as 9 months ago around various issues of this pandemic aren't necessarily true today. So news stories and memes that are old may not have been false at the time, but may now be misleading when they're shared today. So looking at how old the thing is you're reading or being shared on social media is critical. And anything that contains a false promise, that, the old adage, if it's too good to be true, it probably is also true on social media, right? Whether or not it's somebody trying to steal money from you or somebody trying to convince you that something will help deal with this pandemic, anything that feels like a false promise is a risk. Overall, the broad idea that I want to highlight here at the bottom is that it does not have to be false to be a problem. There's lots of content that may not be easily fact-checked, that may not be easily confirmed or denied, but if it's sketchy and it falls into any of the categories I just described here, it can still be a problem. So it's really important to recognize that it's not as simple as, did Snopes review this, or can I find information about this on the CDC? Those are both great places to look, but there's actually a much wider range of information that's getting shared today, especially about the vaccine, about the side effects of the vaccine and things that make people hesitant, that we really have to be focused on and vigilant about. I'm going to jump through a couple of very brief examples here to explain what we mean when we talk about these issues. However, I put this slide here to say we need to pause for a minute and recognize I'm going to show examples of things that are misinformation, of things that are misleading, and that's dangerous. And really, in some sense, I shouldn't be doing it, but we've found that actually showing people what we're talking about helps them to understand and recognize it in the future. But I want, as I show you these examples, for you all to recognize that what I'm showing you are examples of mis and disinformation. I'll attempt to rebut them where necessary. I'll look to some of the other experts if we can even to chime in on them, but be warned that what I'm showing you are things that are problematic. The first example, and I think this is one that we see circulating quite a lot, is data that is shared out of context. There is a database run by the CDC that stores all of the reports of adverse events or bad side effects that people experience when they may have also taken the vaccine. We see those numbers shared all the time on social media, but they are not shared with proper context. The medical professionals you heard from earlier, they're the ones who can actually give you proper context. But when people are sharing information on social media, they don't provide it. And frequently they're providing it in a way that's designed to scare you. So it's important to recognize that when you see numbers batted around on social media, you should check those. You should look for other information about them, or you should recognize that those are frequently being shared without context. So when they say this many people had this side effect or this many people have died, those numbers frequently don't mean anything at all. They may not even mean what the people said they mean when they shared them. So anytime you see data shared around this pandemic, you have to be skeptical, you have to be vigilant. We see lots of pseudoscience, people taking one little bit of information and translating it into something else. We know that the vaccines, the two major ones in particular, are what are called mRNA vaccines. That relates to DNA. And that has been confusingly translated into the idea that the vaccine changes your DNA. I will say this right now, and I'll say it again later. The vaccine does not change your DNA. But because people are saying it, people are afraid of it. Because people talk about it using scientific language and scientific imagery, people start to get misled about it. Anytime you see social media posts that try to get too in the weeds on science, and in particular, when they are designed to make you fearful, those are things you need to be skeptical of, you need to be vigilant about. Anytime people are making comparisons, various forms of logical fallacies, that my favorite is the false equivalence. False equivalence arguments, if this is true, then that must also be true. These are flawed logical premises. And anytime you see any argument on social media that's employing, if this is true, then that is true, or we should blame it because of this, those are tricks. The person who's sharing it might not be the one who's conceived of that trick and is trying to trick you, but these are premises that are incredibly dangerous. They're almost impossible to refute. They're impossible to fact check, but they are dangerous. They are misleading. Finally, and I'm not going to spend much time on this, conspiracy theories. Anytime you see someone trying to blame a boogeyman or trying to blame some ulterior motive for what's going on, that's something to be skeptical of. Now, I recognize I'm talking to a pretty specific audience here. This is an audience who has every right to be skeptical of, paranoid about the United States government. I share those paranoias and skepticisms broadly. However, when people are trying to share those concerns around this vaccine, it's important to look a lot deeper and recognize that while those concerns are critical writ large, are critical historically, in the context of this vaccine, they may be misplaced. And you need to think critically about anything that you're reading when it comes to these issues. So what can you do, recognizing that you're probably seeing some of this stuff, or you might, now that you know a little bit more about it, recognize it when you see it in the future? Well, you should be looking actively at what you're seeing on social media, recognizing that your friends and neighbors are also susceptible to this, and that it's just as much your responsibility as it is mine or anyone else on this call to be vigilant and recognize when we're seeing mis and disinformation. Where possible, you should report it, and I'll explain how to do that in a minute. We're partnering with California Native Vote to provide a tip line to you so that you can report that information, so that other members of the community and other experts from public health officials, the CDC, academic researchers, newsrooms, everyone has access to understand what mis and disinformation is spreading. And then, based on what you've learned here today and in other places, take an active role in listening to other people who share this information, who express skepticism, talk to them, ask questions. And when you know something is false, share good information. We're all responsible for our friends, family, and neighbors getting the best information and staying healthy. And so taking an active role in this, we think, is another part of our civic responsibility. So what can you do actively to partner with us and to partner with California Native Vote? You can report what you're seeing. If you're sitting at a computer and you have a mobile phone nearby, open that mobile phone up right now, open up the camera app and point it at your screen. This QR code will invite you to save a contact to your phone. That contact will be the California Native Vote tip line. It will be essentially a bookmark to this phone number, which is an SMS phone number, this email address, this WhatsApp number if you use WhatsApp, and this website, which is a form where you can submit information. And anytime you find something shared on Facebook, on Twitter, on Instagram, on TikTok, on WhatsApp, or any other place online that you see something, or even if you hear something, you can go to this web form and share things that you're hearing or people are talking about in person, not online. You can share it to our tip line. That supports a really large network of researchers working to understand and combat the problems we're facing with mis and disinformation. So once again, I'll just remind you, you can take your phone, point the camera app at this QR code and click add to my address book, and you'll add the California Native Vote tip lines to your address book. Once you do that, and I'm going to jump ahead really quickly because I know we're running out of time. Once you do that, if you're looking at social media, your Facebook feed, your Instagram feed, your TikTok feed, each one of those platforms, especially on your mobile device, has some kind of share button. All you need to do is take something you're seeing that looks problematic and click that share button. You can say share via SMS, and you can find, this one says NCOC, but yours will say the California Native Vote tip line. You can say SMS, send a text to this number. It'll generate a link and you can text that and you'll get a response back. Thanks for the tip. You can do that via email. You can do that via SMS. You can do that via WhatsApp. There's a number of different ways. And if you need any help, you can email help@junkopedia.org, and I'll paste that into the chat later if you run into any problems. But we invite you all to help participate in this process. The same goes for WhatsApp. If you see something on WhatsApp, find that message, click the forward button, forward it to the California Native Vote tip line on your WhatsApp, and that message will be sent directly to us. I'll just reiterate this last point. We feel like it's our shared responsibility to understand and address mis and disinformation. Today, we're all talking about COVID-19. Someday, I think we all hope this will be something that's in the rearview mirror. However, mis and disinformation will not be. Mis and disinformation is going to affect every social issue that we face from now going forward for quite a long time. Recognizing that addressing mis and disinformation and doing our own part is just as important as voting, is just as important as helping your friends and neighbors in whatever ways they need it. So we invite you, if you're interested, to join us and help participate in the process. And I'll make sure you guys get a copy of these links after the presentation. And with that, I will stop.
Thank you so much, Cameron. And yeah, definitely a shared responsibility. And I don't know about y'all, but that was an action-packed 1 hour, huh? That was a lot of information from all of our great speakers. So thank you to Pat, Dr. Blackwater, Virginia, to Cam. Thank you for all of the great information. We're down to our final 2 minutes, or actually our final minute now. And I just wanted to remind folks that please do drop in your questions, your comments in the chat or on the comment section on Facebook. We'll be answering them to all of our folks who registered. We have your email addresses here stored, so we'll be able to follow up with all of this great information and the slides that were shared by Cam as well. And I think with that, we do have an opportunity for free statewide free PPE for anyone living within the state of California. We have masks, hand sanitizer, gloves, face masks, you name it. So please feel free to ping us. We're on Facebook at CA Native Vote, or you can always email us as well. Our website, canativevote.org. We'll be more than happy to send you, your family members, your friends free PPE. If you have any questions about the content that was shared today, if you want to connect with any one of our speakers, we'll be more than happy to make the introduction. But yeah, thank you so much for taking time out of your day to participate in this really important event. It says a lot about our community that we're able to jump in here and be open to listening to this information and hearing directly from some of our community leaders. So once again, thank you so much. Next time, I promise I'll make an event an hour and a half long, so we have more time to be reciprocal here with the information sharing. So with that, I hope everyone has a nice day. Please continue to stay safe and reach out to us if you have any questions. Thanks, everyone. Bye.
Thank you. Appreciate it.